Time for our weekly mental health check-in. This morning, we're taking a closer look at the impact of a nationwide Adderall shortage.
Yeah, that's right. Plus, you've also heard of that quiet quitting trend. Well, now employers are responding to a shift in workplace culture with what's being called quiet firing. We have tips on what you can do if you think it's happening to you. Let's bring in Dr. Erica Richards for more. She's the chair of psychiatry at Sibley Memorial Hospital and an assistant professor of psychiatry at Johns Hopkins Medicine. Dr. Richards, thanks so much for being with us. We love this segment. We appreciate your time. So the FDA recently announced this nationwide shortage of Adderall as manufacturers are struggling to keep up with demand. Tell us what happens when someone who needs Adderall is unable to get it. Is there anything that somebody can do to cope in the meantime?
Good morning, Savannah. So the issue with the ADHD medication shortage, Adderall, is that this has been going on for a few months now. The FDA announced ongoing limited shortages. This is because of manufacturing issues, labor shortages, and just increased demand. The important things to remember if this is affecting you are that there are options. Number one, consider a different pharmacy. The shortage may not be universal in your area. Number two, identify other interventions that work for you, cognitive behavioral therapy, for example, or other coping mechanisms. But most importantly, reach out to your doctor, talk about other options, certainly before stopping the medication, but also they may be able to prescribe a different dose that may be available. They may be able to prescribe a combination of medications. So very important to talk with your provider.
So, Doctor, we have talked about the Great Resignation, this trend of quiet quitting, and now we have this new term, quiet firing. So what is that? What are some of the signs of it? And how can employees and bosses work together to create a healthier environment at work?
Good morning, Joe. So quiet firing. The pandemic has created a lot of job uncertainty, both on the end of employers, but employees as well. So the answer, so to speak, for quiet quitting is the quiet firing, which is when your manager stops giving you certain assignments. They start to phase you out. You're not fired, but you're left off of important emails, for example. You're not invited to important meetings. Maybe sometimes you're put on a performance improvement plan. What do you do if this is happening to you? Well, number one, you can certainly speak to management and try to figure out what's happening, what can be changed. Number two, understand the new confines of these new assignments and see if you're willing or able to fit into those boundaries. And number three, remember there is always the option to pursue other interests. It can be demoralizing for not only the person it's happening to, for other workers. So it's important to address these issues immediately.
Absolutely. All right, doctor. Also, this is when we teased right at the top of the show. A new study shows smiling can make us feel happier, even if it's just a posed smile, even if you're forcing it, faking it. Walk us through this study. Why does a simple little smile lift our spirits?
Well, first of all, everybody just try it right now. You'll have part of the answer right there. But the process is known as facial feedback hypothesis. This idea that facial expressions may influence our emotional experience is an important concept. Researchers did a global study where they included over 3,800 participants that saw when the mouth moves in the direction of a smile. So they weren't told to smile, but to move their mouth in the direction of smile, they felt happier. Now, we're unsure about that mechanism. The belief is that the smile triggers neurons to signal the brain that we're happy, and then the hormones, the neurons start to catch up so that you actually do feel happy. It's not the answer to treatment for depression. It doesn't take the place of therapy, but just something that we can all implement on a daily basis that may really make a big difference in our lives.
Brighten the day of those around you, too.
Yeah, like also just move your mouth in the direction of a smile. We're not going to tell you to smile. Dr. Erica Edwards, thank you so much.
Dr. Erica Richards, thank you. Appreciate it. Coming up on Morning News.